Yeah, hello everyone.
Hello.
Really glad to see you here for this panel. And I was actually a panel that was very spontaneously prepared for this healthcare stream. So let me first start introducing Huda. Welcome Huda Bustanji. So Huda leads Global Data's EMEA telecom market and data intelligence practice. So she focuses on providing analysis and strategic insight on telecoms, ICT, digital transformation, etc., and globally actually. And then we have Dario Giuliani, director at Brighter Bridges, and he's actually the founder of Brighter Bridges, a leading research and business intelligence platform dedicated to underserved markets, for instance here for the African markets and also the healthcare sector. And then we have Sam Ajadi from product marketing manager from Zipline, where he works closely with the go-to-market sales, regulatory, product and client success teams in Africa to represent Zipline's story, impact, and mission to potential clients and partners. And of course, you're going to tell us more about Zipline later on. And last but not least, Sam Sturm. So we have a couple of Sams here today. Chief Venture Architect at Founders Factory Africa, where he's leading the team that focuses on turning promising ideas into breakthrough innovations, managing Founders Factory's venture studio to develop new businesses from the ground up until maybe Series B investments. Yeah, so again, I'm really happy to have you here. So our panel today is about healthcare technology, a leapfrog for the continent. So of course, it's a very broad, I would say, subject on a very large continent in different markets. But maybe let me start first with Huda, who has like an extensive experience on the telecom market, but also on the healthcare market globally. Been working on with the private sector, also with the public sector. And now, of course, there was like this impact of COVID-19 on the past years that made a tremendous impact on health technology. So could you tell us a little bit more about the trends and the drivers of this market for these years and for the coming years?
Exactly. So health tech or digital health really has been instrumental in helping governments, healthcare providers, and societies in general cope with the pandemic, and also more structurally help transform the healthcare sector and in terms of, let's say, achieving more patient centricity, improving healthcare outcome for patients, helping healthcare providers gain in efficiency and widen the healthcare accessibility basically to a larger portion of the population, to remote areas, and so on. So digital health itself draws on the benefits offered by technologies such as high-speed broadband, IoT, AI, cloud services to fast-track the industry's digital transformation and help patients access more services. So we've seen, for instance, telemedicine applications become more widely adopted within the population. We've seen remote patient monitoring use cases as well pick up. And we've seen largely governments also loosen the regulations to enable and facilitate the uptake of health tech solutions. So for instance, many governments have enabled e-prescriptions and sending e-prescription from a prescriber to a pharmacy. We've seen examples of e-prescriptions being also reimbursed by insurers. We've seen in the US teleconsultations being more nationally widely available and enabled at the at a national level, as well as being reimbursed. So these are the kind of trends we're seeing right now in digital health. And digital health is an enabler that in many cases is able to support bridging the infrastructure gap, the skill sets gap that are experienced in a number of countries, and work towards achieving what I call healthcare equity within the same country or across countries as well.
So you've seen like a big reactivity from the countries, some countries, in order to adapt their governance or regulations.
Yeah.
Have there been like some disparities between countries, or you've seen like a lot of countries making the pace like very, very rapidly?
In terms of disparities, of course, there are disparities. There are countries that have been able to respond faster. There are countries which have made digital health a national priority through, for instance, a clear national health strategy, which really sets out a roadmap for the digital health initiatives that are going to be prioritized, dedicated funding, like in Germany, for instance, the Healthcare Act has dedicated 200 million euro a year for the next 5 years, which sets out a clear and investment-friendly regulatory framework, as well as putting together the private and the public sector and fostering really in a health tech innovation ecosystem as well.
Okay. Coming to you, Dario, now with more like hands-on on the reality on the ground on Africa. How can you tell us about all these initiatives that was telling about who they're right now? What was the reality in some African countries on these past years, either from a governmental level or the ecosystem level or the startup level per se?
Sure, thanks. I mean, as Huda was saying, I think there's a division that needs to be highlighted when people talk about healthcare everywhere, but especially on the continent. There's an aspect of infrastructural, government-driven innovation and agendas, and there's an element of private enterprise. So we're talking about entrepreneurs, we're talking about founders, we're talking about corporate innovation and corporate initiatives in general, and then the investment aspect, right? So Brighter has specifically focused on the ecosystem development. When we talk about ecosystem, we refer to the variety of stakeholders that concur to building a tech scene, or specifically tech. We're talking about tech in the report that we launched early this year. So we looked at the work that has been done by corporate, the work that has been done by private and public investors, both sort of on the development side and on the more commercial side. We looked at the startup at all levels, so at a very early stage, like the ones that, for instance, Sam and Funders Factory tend to address and support, or organizations that have scaled massively and they are now kind of replicating the model across the continent, such as Zipline, for instance. And what we've observed in the report that we launched in June is a number of clusters. And this cluster can be divided between kind of physical and like focus on physical elements of the healthcare space, and other focus more on the service provision that can be delivered digitally, right? So we looked at healthcare management, which includes something that you mentioned about electronic medical records, about digitizing the whole administrative side of healthcare, which works very synergistically with hospitals, right, with clinics. We looked at telemedicine, which is now becoming the buzzword, right? The cool thing in the space. Telemedicine that is applied to, I think, earlier on you were mentioning radiology, right?
Yeah.
You're mentioning a number of services that are being digitized, so things that can be delivered over the phone or over a tablet and can be easily taught to the healthcare personnel. Then we looked at the medical supply chain, including companies like Zipline and including companies like M-Pharma in Ghana, in Ethiopia, and organizations that are really trying to connect the existing clinics and existing pharmacies and existing kind of pop-up shop with the customers. And then finally, if memory holds, is the finance space, which includes financing, which includes insurance, which includes credit for customers and for patients. This is, I would say, is the environment that we look at when we talk about healthcare. Something that I really care about is always mentioning that when you're talking about startup, you're not talking about the economy in general. You're not talking about population needs in general. You're talking often about a niche that is addressing another niche, meaning entrepreneurs addressing perhaps a middle class or businesses, it being a B2C model or a B2B model or a B2G model in the case of companies like Zipline selling to government. But there is the need to really focus on what healthcare needs at a systemic level. So you still need ambulances, right? You still need roads. One of the most interesting conversations I've had with Dr. Ola a few months back while putting together the report, where she was telling about the story of how she launched Flying Doctors in Nigeria, right?
Yeah.
And that's a reality. Like I had recently someone saying that her relative ended up in a car crash in the southern part of Africa, and he had to be flown out via helicopter into Joburg because the neighboring countries didn't have either roads or an actual kind of neurosurgeon or a surgeon in the hospital that was available. So there's actual non-tech related needs that need to be addressed, meaning the education of doctor, the availability of roads that take you from A to B, the availability of facilities that, because we all know that the continent has an issue with continuous power, right?
Yes.
And what we're seeing is obviously you can have laptops going off, but you cannot have fridges holding blood batches going off, right? And so there's an element of like basic infrastructure that needs to be addressed, and I care about saying that what we're looking at on the startup side isn't necessarily, I would say, like comprehensive, or like it doesn't need to be the panacea for what then the healthcare sector needs.
Yeah, thank you, Dario. And then the B2G part, because and I'm going to make like the liaison also with what governments have done in other countries. So I guess, and you tell me if that was the case or not, that the COVID-19 situation was a boost for better B2G collaboration, especially in countries, at least from where I'm coming in Tunisia. B2G and private and public partnership are not like the most comfortable, I would say, way of doing business. So how did that impacted your business? And after, of course, presenting rapidly, what are you doing?
Yeah. Thank you. It significantly impacted the work we're doing at Zipline because when COVID-19 hit, it was emergency mode, and for those that don't know Zipline, so Zipline is basically the world's only aerial logistics service. So we deliver blood, many medical products essentially, so from blood to vaccines to routine vaccines, COVID-19 vaccines, medications. And so when COVID hit, there was a real need, the supply chain across across the world, but if you look across the continent, was severely impacted. And especially when it comes to the last mile, which is where we're active. So we worked closely with governments in Rwanda, in Ghana, and also we saw interest across the continent, with people coming up to us and saying, how can we apply this technology you have in our country? And what's the pace at which we can set up? In terms of delivery, what we were able to do in the last, if you imagine the first 3 years of Zipline, we were able to achieve those kind of numbers with vaccines in like the 4 months after that. Wow. And it was just that pace that we needed to respond quickly. So that's essentially, we had to respond quickly and set up systems to make sure that governments can respond to the challenges that they were facing, with the pandemic.
So, and are you working only with governments right now, or are you expanding more to private B2B?
Yeah, so we actually work with the private sector, right? So we're active beyond Africa. We're also active in the US. One of our biggest clients and our number one client was with Walmart, and the idea was to collaborate with them to deliver to deliver medications directly to patients, and this is a model that we're looking to adopt in Africa as well. And so we're speaking to a number of pharmaceutical companies. We believe that the future of Zipline would go beyond the public sector, and we already have the infrastructure in the countries that we're active in. And so why don't we leverage that to deliver, to do market access? There are huge opportunities there. We're delivering to, nearly 2,000 health facilities in Ghana. We're active in over 50% of like population. We can reach them, and so there's huge opportunities for market access for that. By mid next year, we'll be able to cover 84% of Ghana, and so think about the type of data that is coming back to us, and the information and knowledge that we're able to access with just delivering any type of like product, medicines, vaccines. So there's opportunity.
Very impressive, actually, and. Maybe I will jump to Sam and then get back to you with a question that is related. Yeah, stay with Sam.
Stay with Sam. Finish it.
So yeah, Sam, you've been now active with a lot of different startups, and I think as a VC and as an accelerator and an incubator for startups, you have more broader, I would say vision about what is really happening on the ground with different projects in different countries, is it that easy today to develop the healthcare sector like the good example that we're having here with Zipline, or are there very focused point that you need to follow before getting into a specific project?
Yeah, I think it's our point of view at Founders Factory Africa is informed, I think, by limitations as much as anything else, right? And the recognition that I think you spoke to it, and Dario mentioned it. At the end of the day, healthcare is not fintech, right? Fintech has enabled anybody to be anybody can participate in commerce. Anybody from your home can be a retailer now, right? And the fintech revolution has enabled that. At the end of the day, healthcare still requires healthcare practitioners to deliver primary care. I'm the son of a surgeon. There are technologies that will make his job, my father's job, easier, that will, enable better outcomes. But at the end of the day, you still need surgeons, you still need nurses, you still need, people on the ground delivering care. And so that can't be replaced. And that is not, people are not scalable in the same way that technology is, right? And so we really think about those limitations and thinking about how is technology going to, make these existing processes more efficient, right? How do we, when we think about infrastructure, we don't think about physical infrastructure. We think about, the technological infrastructure, right? Who's developing, the data interoperability between the pharma companies and all the telehealth companies, right? That you have this explosion of. Who's building the technology that telehealths are developing? Who's connecting them to primary healthcare systems, right? So we think about, how do you develop the interoperability that makes all these new technology offerings start to speak to each other? How do you develop the technology that makes them more efficient, that makes them more effective? We think about like precision medicine is a really interesting area for us. How do you, leverage these technologies and feed them back into a system to develop better solutions? But I think like recognizing for all of us the limitations of what, particularly us, where we are not a research institution. We invest really early, and the check sizes that we write at Founders Factory Africa aren't going to fund research. Look, we sit here, and I think, Zipline is, I would have said this even if Sam wasn't there, but Zipline, is one of the most incredible, impactful health, startups, but definitely in the healthcare space on the continent that we've come across because of the scale that they're at. But it still requires to deliver medications and vaccines requires, somebody developing those medications and vaccines. At the end of the day, like as we sit here, a malaria vaccine has just been
Discovered,
has just been approved. Like that's 260,000 kids a year under the age of 5 die of malaria. Now there are going to be all sorts of challenges in deploying this, and supply chains are a mess, and so the questions now are like, how do you get this to people? How do you make sure that it's multiple courses? How do you make sure it gets taken in the right way? But that is the kind of changes that makes are orders of magnitude different, and I think those recognizing that that's not the kind of, for us, that's not the kind of challenges that we're tackling, just because we're not positioned to that's billions of dollars of research that's gone into that. And those kind of things are happening alongside. So our question is while those changes are happening, how do we support entrepreneurs in areas that we believe will make, the distribution more efficient and more, maybe more equally distributed? How do we think about, interoperability of data and kind of more the patient experiences, the doctor experiences? So I think for us, it's as much like recognizing the limitations and the way that, healthcare and ag is another. I think ag's, I know this isn't an ag panel, but we invest in ag also, and I think it's like agriculture requires farmers to pull things out of the ground. People need to plant things and pull things out of the ground. You can't replace that with technology, right? And so I think if for all of us, it's a real question. Like that is a limitation and always will be.
Yeah, if I can quickly follow up on some very good point on the limitation of health tech. You touched upon the interoperability problem. So when you look at the digital health ecosystem, there's this fragmentation today and dispersion, not only in the terms of the multiplicity of the stakeholders, so from primary care to ambulatory care to acute care to pharmacists to insurers, payers, each coming with its own legacy systems, new systems, devices, processes, health records. And then you have on the other side, the IT infrastructure, the hardware, the applications, the software that don't speak to each other, that are siloed. So this is a key consideration for any digital health provider to take into account. And there is an opportunity today to position as an aggregator of this market, as somebody who basically would bring all these ecosystem players together, from the sensors to the, when you think at how we deliver a digital health use case today, you need the basic connectivity, be it through 4G, 5G in the future. You need the sensors, this is the Internet of Things, to capture data. And then you need the platform, the healthcare platform that needs to be open, interoperable with a lot of APIs and can support, the applications. So,
but sorry, wouldn't that be the role of, because this is more of a regulation-like part, because in order to aggregate everything with speaking the same language, basically, so we get them back maybe to the role of the government.
Exactly.
And some government, I know that they are not, the readiness is still not there. So until we get there, we are just like composing with, dealing with half-like solutions. Like, for instance, like where I work right now, it's you have like hospital management systems. You have like 10 in the country, used like in 500 private or public hospitals, and there is zero interconnection between these companies. So either you're going to bring them all together in order to make that, but that's not going to be feasible because they are competitors. So because they want to have the max of the companies there. So I think it's the role of the government that should intervene at a certain moment here.
Yeah, and provide guidelines and force basically any healthcare provider to a list of requirements in terms of interoperabilities and open APIs, but also we need to touch upon the security aspect. We're dealing with very sensitive data here, so we need guidelines and clear rules in terms of data privacy, security, and data residency, because we're talking about more and more cloud-based applications. And I think this is a key consideration in any health tech solution. And it can basically accelerate, if these things are clear, this can accelerate the further deployment and adoption of digital health.
Yes, but I would also posit that like if we're going to wait for governments to create the policies to guide this, the five of us could sit here, we'll be here in 10 years from now having the exact same conversation.
Yes.
Right? So like government is never going to be it's never going to be the lead on this. It's also never going to be the fast follower. Right? So I think this is where, data privacy I think is a great example. Right? Like I think there are some amazing startups on the continent, some amazing entrepreneurs looking specifically at like, great, how do we solve this data? Like how do we solve the data privacy issue in telehealth? Right, like thinking about exactly that very specific problem. So I think for us, what we see is, like, yes, interoperability is important, but like there are so many niche challenges that are massive in scope when you think about the way that like the fact that digital tools, that IoT is exploding. Great, like what are the languages that those are going to use to speak to each other? Like that's an opportunity, and it has scale, even though it remains pretty niche. And at least for now, I think when thinking about the opportunities in digital health, that for us is, I think that's where there's opportunity and scale.
Sam, I want to jump on maybe like other subject, and that is your company incorporated inside and outside Africa? And if yes, is that also an enabler for startups that are active inside Africa in order to get access to more network, to more financing than to a company that is only incorporated in Africa? And maybe Sam and Dario, you can elaborate on that later on. We still have maybe like 3 minutes to.
Well, I could, yeah. There are questions you can sort of predict, but I didn't expect that one. No, we are incorporated in Africa, and so we are a U.S. company with our key operations in Africa. In terms of access and network, I think it's fair to say that, the company was kicked off in San Francisco.
Yeah.
And so access to funding is a lot more, there's high access to funding if you compare it to, the US, if you compare US to, one of the countries in Africa, But does it help in terms of access? Yeah, I would say sure, it does help. But I think at the end of the day, our investors are looking at us that, okay, you've spent the first 2 years perfecting this technology. Now we need to see some results. Now we need to see some scale, and so that's what we've been able to produce. And so the impact of our work has really driven even more funding. And so it's kind of the cycle. But yes, we are incorporated in Africa and outside.
No, okay, so I'm glad you made this, because I was going to intervene before, but I do think the analysis of capital, what we call like the demographics of capital or the composition of capital, is key. Obviously, the Silicon Valley has an amount of money that is different from the amount of money going in the sector. But like, sort of departing a bit from tech and moving a bit into more like econ, I would say, like, the bottom line is governments make money off taxes, or at least in well-functioning countries or moderately well-functioning countries, they get tax revenues, right? They call it, I was just thinking about this a few days ago, tax revenues, because revenues, they are revenues of the government, right? Surely they have revenues from state-owned companies and oil and mining and private sector, and having stakes in all these companies. But we need to look at the reality, as he was saying. Like, if we had to wait for governments, we'd be here sitting for another 50 years. So we need to look at the reality. Most of the public service provision worldwide is sort of supposedly conceived as a public good, a public matter, right? Mm-hmm. So that's why I said we shouldn't think of health tech as a kind of panacea for the solving basic issues, right? Because I guess we all assign to governments that role of being in charge of this, but when you actually look at the composition of capital in Africa, especially in the healthcare sector, what you find is the Gates Foundation. You find, the GSMA has been putting a bit of money. See this Finance Factory guys. You see, and this is talking about like very small checks, right? Talking about millions. And then you get some of the DFIs putting money into now private tech, but then you see CDC guys who've been putting money into hospitals and clinics. And why am I mentioning these names? Most of these names are effectively development finance agencies, government, foundations, NGOs. Yeah. And then there is a kind of sprouts here and there of private capital entering the healthcare sector, especially in the tech, see, we're talking tech, but it's very nascent, right? Yeah. There are a few that are entering the space, Asian investors, corporate investors. Nearly, I would say, half of the known pharmas are now involved in some degree of innovation fund. And I do believe, as you asked before, if COVID acted as a catalyst for private money and corporate money entering the space, 100%. Yes. I think the Pfizer and all the others that haven't been maybe putting money in the tech so far consistently would probably start sort of jumping on the bandwagon of this and coming from all sides. Okay. I know that you're looking at the clock. I'll give you back to you.
Because I just want to give like a couple of minutes for the audience, maybe if they have a couple of questions before we close up this session.
I could ask one. Why not?
Excellent.
What are the challenges you guys are? You're already in Africa, doing tested projects there. I can feel that you're doing extremely very well. Also, return on investments, making impact on the community where you work. What are the challenges that you face while operating in Africa? What do you think might be the challenges? Why private capitals are not coming into Africa to help make changes in the health sector? For over 6 decades now, my people are still suffering when it comes to healthcare. Nigeria alone spend over $2 billion yearly going overseas for medical tourism. What could be the best way that we can close this gap? Thank you.
I think this
is for you too.
This is, yeah.
That is a really, how truthful should we be? Well, I mean, why are people not investing because they're scared? Or are they scared because to global investors, Africa is scary, right? Like the systemic issues are like very well documented. So it has, I would say it has as much to do with like reality as it does perception. I will sound a hopeful note. The hopeful note is that from an investment point of view, you're starting to see the kind of valuations and exits on the continent that make people willing to put in riskier early stage capital. And at the end of the day, that is what investors are incentivized by returns. And so if they see a potential for exits and potential for returns, you'll start to see that, and profit overcomes a lot of other challenges. So I think that is part of it in terms of what will help investment, at least from our point of view. But I think and when it comes to challenges, the other question you ask is like, what are the challenges of startups on the continent? And I think I would ask Sam as well, because he is the one here who's at a startup and an operator. But for our portfolio, I mean, early stage, it is in many ways no different from a startup anywhere in the world. Like getting your first customer, right, is a challenge for a startup in San Francisco or London or Accra. It doesn't change, and what it takes to build a company remains the same. I do think that that the big catalyst is going to be getting the type of support, because it's not a capability issue, it's a support issue. But you're the one here who's an operating company.
No, that question could take an
hour.
hour.
That's an entire conference.
10 seconds.
That's an entire conference worth of.
We're really running out of time. Yeah, 10 seconds.
10 seconds, all right. I think, healthcare is just, generally it's a challenging sector, right? Because in many ways it's a public good that government should provide with education, right? And so private capital, generally investors are weary of these types of industries where you're like, if we jump in, what are the chances that this could be shut down? So that's one challenge. I'll leave it there, and then we could talk after. But there are tons of challenges with healthcare. But
thank you really all for this exciting exchange that we had this here in discussion. And yeah, let's keep continuing this discussion. Yeah.
thank you.
Thank you all.
Appreciate it. Thank you guys.